Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and I'm in Dyersburg, Tennessee today at Sports Plus Dyersburg. Joining me is Cathy Sudbury, jt.sanders, and Matthew.coleman. How's it going today?
Good.
You good?
Good.
Doing great. Thanks for having us.
Thanks for coming on. So I wanted to come in today and talk about why physical therapy. Why is physical therapy better than maybe other types of therapy? Why should people choose physical therapy over other forms of therapy, say a chiropractor or something else?
I think it's a fair question. You know, anytime somebody's got an injury, there's a lot of questions that go through their mind, like, what do I do? And the first thing that I think people do is they try to figure out, is this something I can fix by myself?
Mm-hmm. They Google it.
Yeah, they Google it. That's right.
WebMD.
WebMD.
That's fair, and we're all kind of that way. We want to have an answer to our questions. If we can answer ourselves, then that's great. And so, we think about, what do people do when they get hurt? I think the first thing that they do is they self-medicate. And so they're trying to fix themselves by using, rest or ice, pushing through the pain. Some people kind of baby it, just give it time. And so, trying to answer that question, that's what we want to do here is to be able to answer that question. Call us and ask us, and we can tell you why you should come here as opposed to going to another medical practitioner.
So what are some of the benefits of PT?
There's quite a few benefits. We can work on increasing your range of motion. That's something that a lot of people struggle with after injury is I can't move my arm the way I could before, struggling putting dishes in a cabinet, whatever you may have going on. We can increase your range of motion. We can increase your strength. We can identify deficient movement patterns and teach you how to correct them. Basically, we get you back to living your life the way you want to live your life.
For sure, and I think there are a few things that set PT apart from other healthcare practitioners, and I think there's a time and place for everything, moderation with those things, but sure. There's a time where PT is the thing that you need. When you think about how people respond after they've had an injury, a lot of times they want to fix it themselves. If they can do that, by all means, if it's calming down, if the symptoms are getting better. If you're unsure, you should always, either contact your primary care physician or you can call us. We'll be glad to answer any questions. If we feel like it's something you need to go to the doctor for, then we can certainly do that and get you referred to the doc. The other thing is, that sometimes they'll go to the doctor. Why do they go to the doctor? They go to get a treatment, and that's really what physical therapy is. It's a treatment. It's a specific treatment for your specific injury, particularly musculoskeletal injuries. And so that's really why we want people to choose physical therapy. And there are a lot of benefits to therapy as well.
Just like medication is a treatment we talked about earlier, medication is a treatment. Physical therapy is also a treatment for injuries or pain or loss of range of motion, any of those things.
And you touched base on something recently. My hairdresser, I noticed she wasn't moving her arm up, and I realized it was a frozen shoulder. There was no doubt. And I kept telling her, I said, that's not normal. What are you doing? Oh, I'm just kind of resting and not doing a lot. Finally, I was able to get her to do something that's called self-referral, direct access, and go see one of our therapists. And the 6 weeks next visit, she's like so thankful that I had encouraged her because she couldn't reach behind her head to even brush her own hair. Mm-hmm. And she's a hairdresser. And it's just knowing when to go to that PT and why you should go. And trusting you guys. That's one thing, is trusting you know what you're doing and how to help it. And that's one of that, why you should go to a PT is, like you said, it is a type of treatment, and the doctor highly recommends it, and you guys are trained to do that.
For sure, and I think it's a great thing that you did, because most people don't know that they have the opportunity to come to PT through direct access. A lot of times that people will just put up with their injuries and put up with their lack of range of motion, those kind of things. And so there are a few ways that people get to physical therapy. One of those is through direct access, and that's a great thing. Anytime somebody can come to physical therapy, just for direct access. What we do is we do an evaluation and we determine are they appropriate. So it's not like we're just treating them kind of willy-nilly without knowing if they should be here, should they have imaging. We're trained to determine if those patients need imaging, if they've got some red flags, if they need to see a physician. We don't hesitate to make that referral if it's needed. The other way is that they go to a primary care physician or they go to an orthopedic doc and they get that referral from them, and which gives them a diagnosis. We confirm that diagnosis here, and then we begin our treatments. So there are a lot of ways to get to PT, and I think it doesn't matter so much the avenue that you go to get here. We're going to get you the care that you need.
Well, the one thing I do want to encourage is that when you Google something, yes, they may give you some exercises online to do, but you guys make sure they do it correct, the correct form, because it's easy to look at it and think, oh, I can do this at home. But it needs to be guided by a professional and teach them what to do and when to do it, because there may be times that they're doing something that should be done maybe 3 weeks out, not at the beginning.
Right. There are a lot of times that we get people in here, that we get people into therapy, and they might say, oh, well, I'm already doing this exercise. I've already been doing these exercises. Baseball players are one of the main culprits of this. They see our bands and they're like, oh yeah, I do bands like every time before I throw, before I play, and it's not the same. You might be doing the same movements, but you may be doing them the wrong way.
The form's off.
You may be doing them with the wrong intensity. You may be missing just one little element to that exercise that's really throwing you off or hindering you from your progress or performance.
Yeah, and I think it's so funny because a lot of times we'll get people in and they'll say, "Oh, I'm doing physical therapy at home." I was like, "Well, who's your physical therapist?" And they'll say Google, or something like that, and it's really not the same. They're doing exercise, but that's what PT is. It's a very specific assessment and direction of exercise, so that we know that they're doing the right thing. And JT, do you think there are good and bad exercises, or do you think it's more just appropriate to the person?
Sometimes there can definitely be bad exercises.
And it can make it worse or create a new problem, correct?
Correct.
So I do want to encourage, this is why when we say why choose PT, it is very important for you to realize that they are trained to help you get the peak performance that you're looking for. And that's not just for sports, that is for everyday living, that a physical therapist can get you back to what you do and make your life the best it can, correct?
Yeah, that's a good point. Performance can be gardening. Performance
Yes.
can be doing your laundry, doing your household chores. Performance is different for everybody.
Yeah.
Or just walking without a limp, something.
Anything like that.
I'm just going to go on a limb here and encourage people, stop using Google for medical things. It's just I feel like oftentimes it can do nothing but like create anxiety that doesn't need to be there. Because like you could say you twisted your ankle and you're like, oh, what's a home remedy for twisting an ankle? WebMD or some other website that might pop up on Google might say, oh, well, you twisted your ankle, so now you need to have shoulder surgery. Like that's a dumb extreme example, but I've seen things like that.
It'll take you down that rabbit hole.
Right.
You're chasing that rabbit even to a worse scenario.
Exactly. So
And we're all guilty of it.
Oh yeah, I'm number one. I've done it several times, but every time I do, I'm like, dude, what are you doing? Stop! You're causing yourself more anxiety than you need.
Yeah.
True.
So
And information's always a good thing. When we can understand our pain, I think we're more likely to forego the treatments that we need, whether that's at home or through a therapist. So we're certainly all for understanding your symptoms, but also allowing somebody's been trained to kind of understand those symptoms to at least explain that to you. So we're certainly not opposed to research, but absolutely you can find any answer that your mind wants to find,
Oh, for
and
sure.
so it can definitely lead you down the wrong path.
So the right path would be calling you guys. What's the phone number they need to call?
That was perfect.
731-286-1115.
Perfect.
Look
That's
us up
good.
on Facebook as well at Sports Plus Rehab Centers, Dyersburg. If you got a question, shoot it to us. So while we're on the topic of why and what's the benefits of PT, one of them is to help prevent surgery. Is that correct? So choosing physical therapy first would maybe help prevent a surgery. Can you give us an example of why and what type of surgery maybe we're talking about?
Absolutely. And it really depends. We can't always prevent surgery, so I want to be clear on that. And sometimes you need surgery. But there are certainly circumstances that, people could rush into surgery. And so it's one of those things that, it's really specific to the patient. But we see a lot of back pain patients that really think they're at their wits' end. I mean, they've had pain that's radiating down their leg. It's been there for a month. And they just think, okay, I'm going to have to get cut on. I'm going to have to get that disc, cleaned up and that pressure off the nerve. I think that's one of the examples that we've seen a lot where, people are just really convinced that's how the rest of their life is going to be unless they have surgery. And sometimes they do need surgery and they do great. So we're not opposed to surgery when it's necessary. But if we can prevent get cut on, that's always a good thing. JT, what's an example maybe in baseball that you've seen?
Well, I was going to say most doctors nowadays are very good about trying physical therapy at least before they recommend surgery. So that's always a good thing. Rotator cuff is one that we've seen quite a bit, and maybe we're not able to get you back to 100%, but maybe 75 to 80% is good for you to be able to live your life the way you want to live it. One example that we've seen a lot for baseball is UCL. So a common surgery for baseball players is called Tommy John. It's a UCL repair. Ulnar collateral ligament is on the inside of your elbow, closest to your body, and it really works to stabilize the elbow, prevents valgus stress, and it's a common injury for baseball players, especially pitchers, to have. We have rehabbed some partial tears that maybe they've tried physical therapy before they had surgery, and it's not fully torn, but it's got enough tissue connecting that the doctor is hoping that it scars down on its own and he doesn't have to go in and repair it. And sometimes we're able to rehab those guys all the way back to the field without a surgical repair. A couple of years ago, we saw a baseball pitcher who had a grade 2 UCL sprain, and he is now pitching at the collegiate level with no problems.
And you guys were a lot of his help, correct? You were able to help train him. And did he have surgery or?
He did not have surgery.
So see, that's a good point right there. You help him get back to normal life and help preventing surgery.
And really missing a whole year. If somebody has a Tommy John, they're pretty much, how long is that? That's long.
Yeah, the rehab on that is anywhere between 9 and 18 months, depending on your surgeon and how your rehab goes. And there's a lot of factors that go into that.
Yeah, and again, it's not appropriate for everybody, but absolutely that's something that, between the surgeon and the therapist, we can kind of try to determine if that's the most appropriate plan of care for you. And that goes back to, why did they get hurt in the first place? Another good reason to come to therapy is because we can identify what caused that UCL to sprain or tear. And so we look at mechanics, we look at, just how they're throwing. We talk to patients about that on a regular basis and about their exercises and really trying to strengthen their shoulder. Generally, that comes from either a loss of mechanics or poor strength in the shoulder. And it's not big muscle strength. People always think, well, man, I can lift weights. I'm fine. I've got big, gross muscle strength. But the fine motor strength, the stabilizers in the shoulder get weak. And so another good reason to come and see us.
Well, this has been a great conversation. Like we said earlier, the phone number is 731-286-1115, and that will be in the description, as well as the email addresses to everyone in the room. If you have questions, feel free to send them in. They love helping their patients. They love helping potential new patients or just answering questions, so don't feel shy about asking them. So thank you guys so much for coming in today. This has been great, and this has been another episode of We Talk Health.